Hello, Blake. Welcome back.
Hello.
Nice to see you again. So we're going to continue on with our physical assessments. Today we're going to focus on your chest and your pericardium, and kind of just going to listen to like your heart, lungs, and all of that. I will do some measurings as well, and we'll just basically make sure I don't find anything abnormal, and if we do, we'll explore.
Okay.
So I'm going to start with finding your anatomical landmarks. Is that okay if I fill around on your chest?
Yes.
Okay, so first, we have your trachea here. This V here in your neck is your suprasternal notch. And if I palpate down, I'm going to feel like a bony lump. This is your angle of Louis. With those, looks like your trachea is midline as well as your suprasternal notch. Angle of Louis doesn't feel abnormal at all. I did identify it around your second intercostal space. And it looks like the way that you're breathing, that your chest is symmetrical and your AP is equal to your lateral diameter. So now I'm going to check out your ribs. So I'm going to listen to you here for a second. Take a couple deep breaths for me. Again. Sit up for me. Do the same thing. Breathe. Okay, just breathe normal now. Okay. I'm also going to do another little thing on you. This is called your, stay sitting up for me. This is called your thoracic expansion. So go ahead and take a deep breath and hold it. Okay, go ahead and exhale as full as you can, but do not take another breath. Okay, perfect. And you can go ahead and sit back. Thank you. All right. And then I am just going to count respiratory rate really quick. My time right here. Just breathe normal, don't worry. All right. So I would say that your respiratory and your rhythm are normal. You're not taking, shallow breaths nor deep. Your movements are symmetrical. I don't see any use of your accessory muscles, which is great. When I listen to your chest, both anterior and posteriorly, I did not hear any crackles, rails, wheezes, bronchi strutter, or friction rubs, which is great because if any of those are present, then we probably need to further explore because you have something going on inside your lungs, which could prompt for concern. Otherwise, when I did that little test on your back, feeling, I percussed down your back, listening for like different sound pitches, basically testing your thoracic expansion. With that, I will say that your expansion was equal. I didn't feel any crepitus feeling down your back. Your tactile from fragmentus 99 is equal bilaterally. And then actually sit up for me 1 second. Do this quick measure. Perfect. Okay, go ahead and lay back. So with your thoracic excursion, so that was like 4 to 6 centimeters. But again, no audible crackles, bronchi, or any other abnormalities within your lungs, which is great. And then the voice resonance was normal as well. So with this, we're going to move on to your pericardium. So this one's going to focus a lot more on your like chest and heart area. And basically lots of listening, nothing that you really need to do. It's more so me listening and seeing if there's anything wrong. So first, I'm going to listen to your chest as a whole. So the areas that I'm going to listen to are, I'm going to listen to your aortic valve, your pulmonic valve, your mitral valve, your tricuspid valve, your mitral valve, and there's something called your Erb's point. And I'm basically just going to listen to make sure they're all in their appropriate location. And then on top of that, I'm going to listen for any murmurs or any other abnormalities you might have in your chest. So up over here, we have your aortic valve. And then over to the right a little, we have your pulmonic valve. And then down a little, we have Erb's point. A little further to tricuspid valve. And then here we have your mitral valve. Okay. I'm just going to listen for a minute, make sure I don't hear anything. I'm going to listen to the apex. All right, so I would say that your apex is in the appropriate location, as well as your sternal borders, your sternum also as well. Any pain or anything? Oh. Perfect. I didn't feel any or hear any abnormal pulsations, which is great. Like I said, that would prompt something. Looks like you don't have any heaves or lifts. And then your apical impulses are appropriately located. They're at the apex of the heart, which is over here where I was feeling it, which is your fifth intercostal space. I did listen to all of the different valves that you have in your heart, which is the aortic, tricuspid, mitral, and pulmonic, sorry. And then additionally, I listened to your Erb's point. All of those seem to be in the right location where they should be. They didn't give me any type of abnormalities, which is great. So with that, I also listened to some different heart sounds. So some heart sounds that can be present are your S1, S2, S3, and S4. Your S1 and S2 were present. Your S3 and S4 were not present. And I did hear some splitting of the S2 when you were inspiring, which is good. And I also listened to see if you had any murmurs, and you were free of murmurs, which is great. And then, like I said, all of your valves were in the proper location, and I didn't have any abnormalities with them. Do you know if you had anything cardiac or lung-wise identified as a child? No. No? Okay. Do you have any concerns or anything today? No. Okay. Well, after completing this assessment, I would say that you sound great. Lungs and heart, your expansions are all normal, and it didn't prompt anything for concern for me. So we will continue on at our next visit with another assessment. Thank you. Yes.